Thank you, Rich. It's a pleasure to be back among friends. Sometimes I'm invited to speak at places where they do not like Medicare. I was invited out to Indiana by the Medical Society to be a dinner speaker. The dinner was held at the University of Notre Dame, where they have this huge building called the Athletic and Convocation Center. On one side is basketball, the other is track and field. In the middle is this huge dining area. And most of the people there were physicians and their spouses. And I was introduced by the president of the Medical Society. I got up and gave my talk. And when I finished, a gentleman, one of the middle tables stands up. He says, "I'm Dr. Shelton. And I want to say to you, Mr. Fine, I think you've got a lot of gall coming out here. Who do you think you are to come into our community and tell us how to practice medicine?" He said, "You're trying to intimidate us, and I, for one, won't stand for it." At this point, the president of the Medical Society leaned over to me and said, "Ignore him, he's a dentist." Rich made the point that the Medicare fight started 10 years before the enactment. It actually started about 50 years before the enactment, and that's when Theodore Roosevelt proposed a national health insurance plan for America. A generation before that, Bismarck gave Germany national health insurance. And before World War I, David Lloyd George gave England national health insurance. And I think many of you know that every industrialized country in the world today, except the United States, has a universal health insurance plan. I mean, we all like Obamacare, but it doesn't do the full job. And I've long been a proponent and worked hard with unions, beginning with Walter Reuther, to form a Medicare for All activity. When in 1934, Franklin Roosevelt appointed a committee on economic security to develop a Social Security program, they came back a year later, not only with the benefits program, but with a proposal for national health insurance. That's when the AMA really got mad. Everybody, including doctors in those days, couldn't find money. It was hard to find a job. It was hard to make money. And the AMA's answer to that problem was to cut the number of medical schools in half. And of course, they didn't like the idea that the proposal for Social Security included national health insurance. And they really scared FDR. He announced that he was pulling that out of the plan, and we'd get back to it later. Well, he never was able to get back to it because World War II came along. But the first president to work for national health insurance was Harry Truman. The first domestic bill he sent to Congress, the first domestic bill after World War II, was national health insurance. And the AMA got mad again, and they hired a public relations outfit named Whitaker and Baxter, and they coined the phrase socialized medicine. And they spent millions of dollars, and the millions went a lot further back then, to defeat Truman. In his autobiography, he wrote that it was his greatest disappointment to not get national health insurance. As Rich mentioned, Amy Ferran of Rhode Island introduced the first Medicare bill in the mid-50s. President Eisenhower would have nothing to do with that. He did introduce a bill to help develop some community health centers. And the AMA called that socialized medicine too. And here was the man who led the Allied forces in Europe to victory, and he was defeated by the AMA. Jack Kennedy became the principal sponsor of Medicare after he was nominated in 1960. Before that, Albert Gore Sr. had been the principal sponsor. I was invited to join the team after seeing them at that Madison Square Garden conference, but I'd been in touch with them before that. I was working for the health insurance industry, and I was appalled at some of the phony figures they were putting out about the extent of coverage of the elderly. I was going to quit that job anyhow, but when they invited me to join the Kennedy team, I jumped. We saw not only phony figures, but we saw them offering policies they used to call them buffalo policies because they only paid off when you were run over by a herd of buffaloes. And yet they were selling these things to get any number of elderly people in their roles so they could pretend, and they pretended in testimony to Congress, that they were solving the problem without any need for government action. I became the designated debunker of the health insurance industry on that team. By the way, I want to take a minute to remind you who are the members of that team. Nelson Cruikshank, his daughter is here, was one of the members. Labor was well represented. Chuck Odell, who was the head of the UAW Department of Retired Workers, was another. Jimmy O'Brien, who had the same job with the steelworkers, was another. Wilbur Cohen was another. Ivan Nestigan was the chair of this group. He was the undersecretary of HEW. Ray Henry, who was Ivan's administrative assistant, was another, and there was myself. And this team worked together very well, and most of us stayed on with Lyndon Johnson. But before we get too far, Jack Kennedy came into the room and told us at one point that Wilbur Mills had agreed to hold hearings. We had a party that night because Mills had been the greatest stumbling block to get anything going on Medicare. 4 years earlier, he and Bob Kerr, a senator from Oklahoma, had actually passed a law, the Kerr-Mills bill, which provided some help for senior citizens in paying bills, but only by means testing. You were not eligible without passing a means test, and even some states wouldn't even go along with that. Also, it was mentioned that the Kennedy Medicare bill only provided hospital insurance because he didn't want to take on the AMA. He saw what happened to Truman. And nevertheless, it was called Medicare. And at one point, Wilbur Cohen, one of the members of the committee, was admonishing it, we've got to stop calling it Medicare. We've got to call it what it is, hospital insurance for the elderly under Social Security. At that point, the president walked in the room and said, how's the Medicare fight going? It was Medicare from then on. The hearings that Mills agreed to hold began in the early part of November of 1963. The first witnesses were three cabinet officers, the secretaries of HEW, of Labor, and of Commerce. The next witness was the AMA, and they were actually testified for 2 days against this terrible idea of Medicare. The next witness was scheduled to be the president of the health insurance industries team called the Health Insurance Association of America. He led the president of an insurance company in Texas. His name was Louis Reitz. And my job was to have members of the committee who are for us. There were 25 members on that committee, 15 Democrats. And my job was to make sure that the key members were able to get a hold of his testimony and denounce it. Representative Al Ullman was the second-ranking Democrat, and he was the one that I was detailed to educate about the real role of health insurance so far. And I spent many hours with Congressman Ullman, and I wrote out all the right questions and so forth. In those days, the committee allowed witnesses to testify at length. They didn't just submit their testimony. And Reed spoke for about 2 or 3 hours on the morning of, get this, November 22nd. Well, when he finished, Congressman Cecil King, who was the principal sponsor in the House of Medicare, along with Clinton Anderson in the Senate, The King-Anderson bill was what Medicare was called. Congressman King asked a few questions, and then they turned it over to Al Ullman. And Ullman had my papers in front of him. Mr. Reitz, you've testified we don't need Medicare because you say the health insurance companies are doing the job. We don't need government. You say that 53% of the elderly already have health insurance policies. Well, we know nothing about those policies, Mr. Reitz, unless we know something about their quality. And here he's reading from my notes. Isn't it true, Mr. Reitz, that of the 53% of the elderly who have policies, more than half have policies that pay only $10 a day when you're in the hospital? And a fourth have policies that pay only $5 a day when you're in the hospital. If witness answers no, ask him the following question. And everybody started laughing. And he went on. But I kind of slinked out of the room. And running up the stairs of the county office building was a man shouting, "The president's been shot, the president's been shot, the president's been shot." And it was on that day that the hearings ended, and Mills came out after a while to announce that the president had been shot in Dallas. But 2 months later, Lyndon Johnson, in his first State of the Union, said, "We are going to get that Medicare program done in honor of the fallen president." And while it took another year and a half, he did get it done. And it was so nice that he flew out to Independence, Missouri to have Harry Truman on hand while he signed the bill. My job in the Johnson administration changed because the Public Health Service, which was part of the Department of HEW, played no role in Johnson's efforts to get Medicare. They felt that public health doctors they don't do medicine, they do public health. And Johnson really got mad about that. And he appointed a new Surgeon General, and he brought in doctors from outside. He set up a division of medical care administration in the Public Health Service. And those words, medical care, were anathema to public health doctors. And that unit, that new division, was responsible for the professional health aspects of Medicare. That division worked hard, for example, to create all around the country, out of VNAs, they created units which provided physical therapy, occupational therapy, medical social work, home health aides. Very few of those units existed. They were just VNAs. And he got the Congress to appropriate $65 million to do that. And in 9 months, they went from 200 of these units to 2,000. And they've played a major role in redeeming the promise of Medicare. I was assigned by the White House to work with Dr. John Cashman, who was the head of this unit. And we did such things as teams went to the South to integrate hospitals. I spent 6 months in Mississippi with a team of 5, including one black doctor, one nurse, and a physical therapist. And Mississippi then was a little bit more dangerous than it is today. Another thing, this may show you what the idea of public health. We decided to make a film to show to doctors that it isn't such what the AMA has been telling you. Medicare is a good program, and doctors can earn money where they were giving free care before. And it was designed to show just to doctors. And we contracted with a filmmaking company in the old Washington Redskins building on 9th and 8th Street, 7th and 8th Street. And I walked in there one morning, and I said, "Good morning," receptionist said. I said, "Hello, I'm Max Fine with the Public Health Service." She says, "Oh, am I glad to see you. We've got a rat this big in the basement." Anyhow, ever since 3 years after Medicare was enacted, Walter Reuther approached me to set up a committee for national health insurance to work for Medicare for all. And Walter died 2 years later, but the UAW kept leading, and the AFL-CIO joined in. Lane Kirkland became the co-chair of that group. And we had a committee of 120 union leaders and 80 of people of all walks of life. And many of their names you'd understand. Dr. Michael DeBakey was one of our leaders in that group. And we got a promise from Jimmy Carter that if we helped him get elected, he was going to champion the idea of Medicare for all. Lane Kirkland, who succeeded Walter Reuther, spent weeks and weeks in Florida working for Jimmy Carter in the primary because nobody had ever beaten George Wallace in the South. And there were tens of thousands of union retirees who actually, I think to a person, voted for Jimmy Carter. And he beat George Wallace, and it really was due to labor's efforts with the retirees. But Jimmy Carter just putting us off and putting us off. He never introduced a bill. He introduced a statement of principles that meant nothing. And the effort failed. We spent 12 years on this effort. It failed. And I still believe we ought to have Medicare for all. I believe, and I'm sure many of you believe, that the poor and the deprived and the plain working people of America have the same right to health care and to life itself as the affluent and the very wealthy. Thank you very much.